New parents spend a lot of time and money to create a beautiful haven for their newborns, but maintaining a clean and healthy nursery can seem like a never-ending task. Top germ expert Dr. Benjamin Tanner and mommy blogger Victoria Pericon join us this morning with pointers on how to keep your tiny tot space disinfected. Good morning.
Good morning.
Good morning.
How bad is it when it comes to the germs and the play toys?
It's a really good question. So, you know, most nurseries, it's really not bad. And I like for people to understand that germs are a natural part of life and you'll find them everywhere. They're ubiquitous. But what you want to focus your efforts on is disinfecting the bad germs. And the nice thing about bad germs is they tend to confine themselves to certain areas within the nursery. And those are what we call hot spots within the nursery environment.
Okay, and what are some of the hot spots?
Okay, so the hot spots in the nursery are the dirty diaper, first and foremost. Has a lot of germs on it. That cascades right down to the changing table. That's probably the #1 surface in the nursery. And then high-touch surfaces like toys and doorknobs, etc. And so then to keep those germs in check, I like to advocate a two-pronged approach. The first is to prevent the germs from spreading. And you can prevent them from spreading with a mess-free changing routine. So a Diaper Genie Elite plays into that process. It has a foot pedal, so you don't have to fumble with a lid during the changing process. That helps prevent germs from getting around. And then on the other end, you want to disinfect regularly with an EPA-registered disinfectant, and that will help kill any germs that do find themselves on the surfaces, and that can help prevent people from getting sick.
Right, and you know, and that's a tough job. Victoria, as a busy mom of 4, what was your previous cleaning routine, and what's changed since that swab test that revealed that you had a lot of germs to deal with?
You know, the results from the swab test that were in the nursery were pretty good. So my cleaning routine hasn't changed much, but I can promise you if it was really bad, I would be doing a lot more things differently. But I pretty much wash my hands right after changing my son's diaper. I, dispose of it properly. Then I also wipe down the changing table. And now I'm a little extra vigilant with the toys and making sure that they're wiped down a little more frequently. But, it's pretty much the same stuff that I was doing before. I continue to do it to make sure that the nursery is good for my son.
Right, so you're doing everything
Victoria had a
right.
pretty clean nursery overall.
So far.
All right, now what kind of cleansers and disinfectants work best to maintain a clean and germ-free nursery and are safe for the kids?
So there's an interesting story with that. So the cleaner you want to use, the brand really doesn't matter so much. What matters is that it's EPA registered, and you can tell it's EPA registered if it says disinfects, antimicrobial, or kills germs on the label. Typically those aren't very toxic chemicals, but because the nursery is a special environment and the baby's skin is very delicate, I like to advocate that after disinfection, people just do a quick water wipe down. Then you get all the benefit of the chemical disinfectant without any of the negative chemical drawbacks, especially to sensitive baby skin.
All right, thank you so much, Dr. Tanner and Victoria. Really good advice there.
Thank you.
Yeah, thanks for having us.
All right, a team of Colorado nurses and EMTs are taking health care to new heights, literally. Fox's Jeremy Hubbard goes on board this emergency room in the sky as they train for their next mission, saving wounded warriors.
Inside the belly of a hulking airplane. It's not exactly an ideal ER.
Check. Patients are here.
Lift.
This way. Thank you. Come to me. Come to me. Stand in the bracket. Ready? Lift. Lift. Move.
But these hospital workers from right here in Colorado have grown used to intensive care at 20,000 feet.
Let me have somebody get your vital signs. Do you have a pulse? I see a pulse.
Inside a cramped hospital ward crafted from a fuselage with simulated patients swinging from stretchers.
How's his breathing?
These medics are training to salvage the war wounded half a world away.
So once we get up to altitude, what the flight crew does is they assess their patient's vital signs to make sure they are tolerated the stresses of flight.
Colonel Kathleen Flaherty from Colorado Springs just spent months in Iraq and Afghanistan leading an entire Air Force Reserve squadron that treated 3,000 patients there.
You control the bleeding on this stuff. How fast do you give the IV fluids?
On this training mission, we are perched high above the mountains of Colorado, but mimicking an actual combat medical evacuation, fake victims and all.
Cerebral hemorrhage that we'd be looking at.
The wounds are as real world as possible, the kind of things they'd be seeing in Iraq or Afghanistan. For instance, this patient has a broken leg. This one was shrapnel wounds to the leg and the arm. they'll treat these patients, get them stable, and to a hospital as soon as possible.
His pulse is racing.
That means rushing patients to better equipped medical centers in Germany or even back here in the U.S. in a hurry. It is turbulent work in more ways than one.
Doesn't talk about any type of blast, possible injury.
Donna Olson, a mom of 3 who works as an emergency room nurse, just returned from Afghanistan, where she witnessed the unimaginable.
You'd have patients with as many as 3 limbs that were amputated.
Carrie Williamson has a 19-month-old boy she had to leave behind in Colorado Springs when she was deployed for several months last year. On one especially difficult mission, she helped treat 7 victims of a Humvee accident, 2 of them multiple amputees.
It was a very emotional place. He's at high risk for acute ischemic stroke.
It is the kind of thing even working in an ER back home can't prepare you for, but it drives home the importance of what they're doing up here.
The more practice that you get, the better you are when it's real life.
And even once they touch down, those skills they've honed at 20,000 feet
2 on the left.
can help them at their day jobs. Back here, treating us civilians in Colorado,
Ready, lift.
in emergency rooms that are a little more ideal than the belly of an airplane.
And that was Jeremy Hubbard reporting. Now, start practicing that pageant wave coming up next. Details about how to become the next Mrs. New Mexico.